Hello and welcome to another concussion education session. As our disclaimer, this is not medical advice. Please consult with a healthcare provider prior to attempting any of the exercises we talk about. When we hold group sessions, this is not confidential as we do record them. And this is me. I'll move myself out the way for a moment. I have my degree in kinesiology from York U, and I have previous sports-related as well as MVA concussions. So these topics are always near to me. I am the community outreach and concussion therapist at Complete Balance Health Center. With regards to guests, if you think anyone will benefit from this video as you're watching it on our social platforms, please share it to them. When we hold group sessions, you're welcome to invite friends, family, colleagues, anyone. Everybody's welcome. So I'm going to move myself out the way for the majority of the presentation. Today's plan is talking about strengthening exercises. I'm going to give some background info, and we're going to go into the specific exercises and always ending off with a discussion. So with regards to our treatment plan, here's our pyramid that I present every session. What we're looking at is exercises and treatment in the top part of the pyramid today. So specifically speaking about neck work. Now, stretches I've gone over in a previous video. We're going to talk about strengthening today. Throwing a whole bunch of terminology out right in the beginning, cervicogenic, cervical spine, neck work, all these things, they often are not technically synonyms, but we can loosely refer to them as synonyms. To give a couple definitions, cervicogenic is cervical spine in origin. Cervical spine is our neck. When we talk about neck work, we're usually talking about neck strengthening or maybe some stretching. Again, neck exercises, strengthening, maybe stretching. Rehab, stretching, maybe strengthening. A whole lot of things are overlapping on that. Postural corrections, also referring to neck work. So this is specific stuff talking about how our posture is, but often involves stretching, strengthening, and different movements. Isometric training, that is strengthening or engaging a muscle without dynamically moving it. And Pettibone is the specific name of some of the exercises that we use or we recommend. Cervicogenic is something that we talk about a lot. And I like this little graphic. While it's not specific to everyone, and it's not specific even all of these graphics, what we're going to loosely talk about is cervicogenic, again, cervical spine, just talking about the neck. And the definition we have from the American Migraine Foundation is cervicogenic headache is referred pain. Pain perceived as occurring in a part of the body other than its true source, perceived in the head from a source in the neck. Cervicogenic headache is a secondary headache, which means it's caused by another illness or physical issue. Now, with regards to rehabilitation, so when we have some neck pain or we're getting some headaches, whether it be cervicogenic in nature or from other causes, if it persists more than 10 days, then cervicovestibular rehabilitation is recommended. Cervical spine, cervicogenic. Vestibular is just a different portion of it. So what I refer to as our ears, more specifically our inner ears. And this is taken right from the latest consensus statement with regards to sports-related concussion from 2022. And looking at another meta-analysis, combined physiotherapy interventions are effective to reduce headache intensity and frequency and can be used as adjunct therapy to pharmacological treatments, interventions. So if you're even taking medication for your headaches, this can still be beneficial for you. Some of the treatment list with regards to this combined physiotherapy interventions talk about joint mobilizations, heat, massage, traction, stretching, exercise, postural corrections. That's taken right from the meta-analysis. Now, stretching, we already talked about in that in a previous video. Exercise, I talk about all the time. This is where we get our daily walks in based on our results from the Buffalo Concussion treadmill test. And postural corrections, our neck work, our neck rehab is what we're going to talk about today. Now, exercise styles. Here's a little graphic. When we're talking about neck work, we're not going to be talking about these dynamic movements, these isotonic movements. We're going to talk about isometric. So tension on muscles without the surrounding joints moving. Isotonic, opposite, that's these dynamic movements. Well, they have a time and a place. That's not the exercises we're focusing on today. So our isometric or postural corrections, we're going to generally or loosely use them as synonyms today. That's a Pettibon cervical program. Some of the tools you need, well, we sometimes use these specific Denny rolls. We also recommend towels or anything else that works for you that you have access to at home. Now, before I go into the specific exercise, I want to go back a little bit. Why is strengthening important? Well, pain can actually inhibit the signals to the muscles, and this can cause weakness because it's inhibiting the muscle. That may be perceived weakness where you feel like maybe I just can't grip something as strong as I feel like I can on the other hand. Or maybe it feels tough to hold your head up all day at work while you're looking at the screen. It can also cause measurable weakness. And one of the measures we use is the cervical flexion endurance test, CFET. Now, the general or the standardizations range significantly in the research. And we very loosely use a 60 seconds hold for a male and a 40-second hold for a female. This data comes from asymptomatic population without injury. So they don't have neck pain and they don't have neck injury, and they were able to achieve these results. What I'm going to do here is I'm going to leave the share, and you're going to see me explain the cervical flexion endurance test. Then we'll also go through the Pettibone cervical exercises. And then I'll jump back into the presentation shortly after. All right, we're here with Martin to demonstrate the cervical flexion endurance test, CFET. And what we're going to cue him to first is to gently tuck his chin. He's going to bring it in just a little bit more, and then he's going to lift his head just about an inch off. Do you notice? Perfect. My hand can be underneath. I'm going to cue him to keep the chin tucked, and he's going to hold this position for as long as he can until he feels pain or discomfort or starts shaking. Noticing my fingers can slide underneath, just brushing his hair. And then when he feels like he's fatigued, he's going to relax down. Excellent. That's the CFET. Now, as we move on to the strengthening exercises, we often refer to as the Pettibone cervical exercises, we're going to have ourselves a rolled towel or a Denny roll or any other tool that we're using, and we're going to place it at the lowest part of the neck. So my wonderful demonstrator will raise his shoulders up a little bit as well, and then lay back down. We basically want to feel this at the bony part on the lowest part of the neck, usually or generally in line with the shoulders. Should feel as if the head is falling back slightly. We're getting a gentle stretch, but no pain, no discomfort. Then from here, again, we are going to gently tuck the chin in a bit and push the head back into our floor, our mat, whatever surface we may be on. We're going to hold this. A good starting point is about 10 seconds. We want to avoid any cramping, any discomfort feeling, but we should feel some work in the neck. And then we relax. We take a moment, we take a couple breaths, and then we're going to go back into the position again, gently tucking the chin down and pushing the head back into our surface. A variation of this exercise, we're now going to turn our head to the left or the right. And a cue I like to give is to think like we are a rotisserie chicken when we're turning our head. We're keeping it still in that same position. We're just turning all the way to the side. And then from here, we are going to push our head back into our surface, our bed, our mat, the ground, whatever it may be, holding for the recommended time. And a good starting point is about 10-second hold. And after the 10 seconds, we'll relax and come back to a neutral position. Nice and slow to avoid any strain in the neck. I'm going to do the same thing on the other side. So now we're turning all the way to the left, keeping that head upright while we're turning. And then from there, pushing back into our surface, whatever surface we may be on, holding that position. While we give a starting point of 10 seconds, you may progress upwards. Generally, we don't recommend going beyond 30 seconds per hold. Making sure we come back to neutral and take a moment to collect ourselves, to rest. Maybe even add in some good diaphragmatic breathing, some good breath work in here. So another variation of this exercise is going to be a bending position. So what we want to feel is that our head is going to bend to the left or the right. We're keeping our eyes and our nose upright. We're keeping our shoulder pressed down. And then from here, we are again pushing our head into the mat or whatever surface we may be on for our recommended time. And once you complete this push, I want you to come back nice and slow and do slow movements of the neck. And we'll do the same thing on the other side. We want to feel like our eyes and our nose are still looking up to the ceiling while we're bending to the side. And once we get ourselves in that position, then we are going to push back again. And always returning back to neutral once we completed the rep. Going through for the recommended number of repetitions, for the recommended time, or what you have progressed yourself to. All right, and now we're back here. So questions, they can be directly to me or to our team. And I'm going to pose some initial discussion questions that you can feel free to send an email or to even comment on the video on YouTube. Have you seen exercises on socials? When I say socials, I'm talking about those who like Facebook, maybe you're more an Instagram person. Some people like YouTube Reels. Some people like social on LinkedIn as well. Have you seen any neck exercises there that you think are cool that you'd love to share? Another question here, discussion point. Do you train your neck currently? So with those with neck pain especially, is that something that you add into your routine, especially with the pain? Sometimes it's important to add in a strengthening routine or a strengthening program as well. So to summarize, I presented our cervical flexion endurance test that we often use in clinic. And we talked about the Pettibone cervical program or the exercises, the neck work, the neck rehab, the postural corrections that we are using as synonyms for today. And I always value those who subscribe to us on YouTube, check us out on Facebook. We even have Twitter and Instagram. If you have any questions, please don't hesitate to shoot me an email. Thanks for listening today. Bye for now.